Hello, I'm Dr. Anthony Colantonio, Medical Director of the Clinic for Specialty Pain Services at Meadville Medical Center. You've been referred for an injection in your neck, otherwise known as the cervical spine. The injection is called an epidural injection since the medication that's injected is injected into a space immediately behind the spinal cord, and that space is called the epidural space. It's located immediately below the bone structure of the spine and just above the fluid column that surrounds the spinal cord. The injection contains steroid and is intended to reduce the inflammation around your spinal cord, inflammation that is contributing to your pain and symptoms. There is no permanent structural change to your anatomy as a result of the injection. Therefore, it is expected that the results will be temporary. The results can last anywhere between several weeks up to several months. The longer the benefit from the initial injection, the better the prognosis that occasional injection therapy will be adequate for your treatment. Otherwise, you will need to discuss surgical options with your other doctors or consider chronic use of non-narcotic prescription medications. The injection is performed under X-ray to increase the accuracy and safety of the injection. For the procedure, you'll be laying in a face-down position, and it will take about 10 to 15 minutes to complete the procedure. You'll be in a position such as this on our procedure table, head here, tailbone here. Under X-ray, I'm able to visualize each cervical bone so that I can accurately and safely position our needle to access the epidural space and complete the injection. If you have any significant anxiety about the procedure, you can ask about the option for conscious sedation. The risks of the injection include bleeding, infection, and dural puncture. These are very rare. Bleeding is unlikely to occur unless you are routinely taking blood thinners. If necessary, we will instruct you on how to adjust such medications before the epidural injection so to minimize the bleeding risk. Infection is also extremely rare. It is very important to note that if you have or develop any infection or illness between this appointment and your scheduled injection, that you inform our staff of that situation right away. In that case, your epidural injection will need to be rescheduled. It would not be safe to perform a spinal injection in the setting of an active infection. Dural puncture may occur during these epidural injections. The dura is the name of the covering over the spinal fluid column. This dura is actually intentionally pierced during a spinal tap procedure, which is done in the purpose to draw spinal fluid for testing. For epidural injections, the intent is not to go through the dura and access any spinal fluid. However, because of the very close relationship between the epidural space and the dura, it is possible to pierce the dura during an epidural injection. If this happens, the dura will heal on its own. The dura heals just like skin, and the hole created by the needle would close within a few days on its own. During that time, while the hole is there can be a slow leak of some spinal fluid, and this could cause a condition known as spinal headache. Typically, the headache is treated conservatively with Tylenol, adequate fluid intake, and bed rest. The headache is more severe when upright, and it is usually relieved when laying flat. It can take up to 3 or 5 days for the headache to resolve. Alternatively, a more aggressive treatment for a spinal headache would be to perform a procedure called an epidural blood patch. For this procedure, your own blood would be drawn and then injected to the epidural space, where the hole is in the dura. Performing the blood patch, however, does carry the risk of another dural puncture, so this is usually reserved for treatment only in the event when conservative measures completely fail. There are some general risks to steroid that you should be aware of. One of these risks is that steroid can have a negative effect on bone density. If you have osteopenia or osteoporosis, steroid exposure could have further negative impact on these conditions, especially if steroid-containing injections are repeated over numerous times. A single injection is unlikely to result in any significant effect on osteopenia or osteoporosis. However, there would be concern in the setting of multiple repeated injections. It is therefore important to let us know if you are currently receiving or expect to receive steroid-containing injections at other clinics from other physicians. Another issue associated with steroid exposure has to do with the concern for the adrenal glands. These glands naturally make steroid in our body on a daily basis. Our natural steroid is called cortisol. If you are receiving steroid injections on a frequent basis, it is possible that the adrenal glands will shut down, and this could cause a medical condition known as adrenal insufficiency. Finally, it is very common for blood sugar levels to increase after steroid exposure. This is of particular importance for diabetic patients. The general medical recommendation is that daily blood sugar levels average 150 or below before proceeding with safe exposure to steroid injection. Baseline blood sugar levels will be elevated and may double or more for up to a week after the steroid injection. This may require diabetic patients to adjust insulin dosing if you are already prescribed insulin, and at a minimum, be very cautious with your dietary intake for the week after the steroid injection. If we decide to proceed with your epidural injection, it is advised that you have a follow-up appointment with your referring physician around 4 weeks after the injection. This would be an appropriate point in time to evaluate the response to the initial treatment. Decisions about additional injections or other treatment options, including possible surgery, will be addressed during that appointment. Onset of relief from the epidural injection averages 3 to 5 days from the procedure.